Hi, this is Jay Summers from Nevada Family Psychiatry. I appreciate you joining us for our next series on attention deficit disorder, both adults and kids. So let's get right in some of the forms that we use to diagnose and treat attention deficit disorder. So we're going to go to our first form that we commonly use to treat kids, which is a Vanderbilt Assessment Scale. This is an initial intake that we commonly use for parents to help us understand what kind of problems are found in kids. So in ADHD, there are probably three primary things that we're looking for: inattentiveness, hyperactivity, and impulsivity. So those three things make the core of what we're looking for with ADHD symptoms. That's attention deficit and hyperactivity symptoms. So as you can see, I'm only showing you the first page here, but this gives you a general overview of kind of what things we'll be asking for and what you'll fill out when you get to our office. So looking at either never happening, occasionally happening, very often happening, or often happening. So looking at making careless mistakes or avoiding things that require mental effort, losing things. And then, of course, we have the hyperactive symptoms, which are typically things like fidgets with hands or feet, leaves seats, runs around or climbs too much. And then, of course, the impulsive symptoms. Those are typically things where kids can't wait in line or can't wait their turn when talking. Those are kids who will interrupt you often. Typically, people have a low frustration tolerance in a lot of things. One of the biggest obstacles in treating ADHD is that it can look a lot like a lot of other mental health issues. Anger, anxiety, depression. Kids especially can present with these symptoms when really what they're having is ADHD, which is typically making them overwhelmed and frustrated. It's kind of like having 10 conversations going at once and you can't focus on just one of them. So this is a very helpful form. The other form we're going to come to is another Vanderbilt scale that we commonly give to teachers. One of the things about ADHD that makes it unique is that unlike some other things that are found in some areas and not in others, like social anxiety or other specific obsessive compulsive things, even sometimes depression, where you'll have it in one area and maybe not in another because of something that goes on, ADHD is not selective. It's found in at least two primary areas of the child's life. So for kids, that's usually home and school. So getting information from teachers is really, really important. Now for grade school, luckily that's only one teacher usually. Sometimes they'll have a resource teacher. For junior high, you're talking about 6 or 7 teachers. Usually the way that we do it here is get information from about 3 different teachers. Usually a math teacher, and then an English teacher, and maybe a resource teacher if they have one, or a special education teacher, maybe their IEP teacher if they're doing that. Getting different areas. In high school, that's kind of the same thing. They're going to different classes, and what we're trying to figure out is, are they having some learning disability in a specific area, or are they having general focus and concentration problems over the whole span of their day? So you can see from the teacher information scale that it's very similar to the parent one. What we're trying to do is see what kind of problems are the teachers noticing in those areas. Are they fidgety? Are they distracted? Are they talking excessively? Do they have problems with losing temper? The ones on the bottom, as you can see, deal more with personal feelings of frustration. Do they fight? Do they bully or intimidate? Are they spiteful or vindictive? Do they steal things? Are they easily embarrassed? Are they afraid to try new things or fear of making mistakes? That's a big thing with concentration and focus problems. So, those are the two forms that we commonly use in kids. I'm going to do an overview briefly of another form we use in adults. Here it is right now, the ADHD self-report scale. So, as you can see, this one's laid out a little bit differently. And this is done with adults, just kind of giving a sense of whether or not they're having the problem a lot or not having the problem a lot. But it looks at kind of the same things: hyperactivity and impulsivity, along with inattentiveness. So in adults, a lot of times that's found at work and of course at home. Sometimes it can be found in social situations as well. But we try and get the same analysis of trying to get information from home as well as what kind of obstacles people are having at work. So you'll see question 1 is, How often do you have trouble wrapping up the final details of a project once the challenging parts have been done? I think we all recognize that doing boring things is particularly hard. For the ADHD adult, that's really hard. Patience. How often do you have difficulty getting things in order when you have to do things? Distraction. Do you feel compelled to be overly active and driven by a motor? That's another big thing that we find in kids and adults. Are you distracted by things around you? Do you leave your seat in the middle of the meetings, or do you find that you have a hard time fidgeting with things? Do you constantly fidget with your pencil? Have you gotten in trouble for kind of talking or moving around in a meeting where you were supposed to stay still? These things are often found with adults with attention and focus problems. That gives you a general overview of the self-report scale that we commonly use in ADHD for adults. So that's an overview of kind of the things that we do commonly in ADHD, both with adults and kids. Obviously, it goes into a lot of different details, but those are the scales we commonly use. A lot of it has to do with what other things are going on. Along with depression and anxiety and anger looking like ADD, sometimes ADHD looks like depression and anxiety and anger. So being able to connect those things and making sure we're not ignoring one thing over the other is very, very important. So I hope you'll join us for our next series of videos. I'm Jay Summers with Nevada Family Psychiatry. Thank you so much for having us.